Hi, I'm Dr. Tess Salmond. I'm a veterinarian. I've been a vet for 20 years down at the Clermont Vet Surgery in central Queensland. I really wanted to be there tonight to talk to you all. I love my JCU vet students, and we have a couple of JCU grads at our clinic. So yeah, I did really want to be there tonight. Unfortunately, I have vertigo, so it means I can't look down without sort of falling over, and I definitely can't drive. So I emailed Maddie, I'm so sorry I can't be there, but I just wanted to contribute a little bit if I was given the opportunity, because I did want to be there, because I absolutely love being a horse vet and being a vet in general. It's such a rewarding profession. Like I said, I've been doing it 20 years, and I can tell you with my hand on my heart, I absolutely love it. So I'm very excited about the next generation coming through. So I wanted to be able to touch base and have a chat to you all, even though I can't be there in person. So bit about me. Like I said, I'm a Clermont girl, born and bred. Grew up riding horses, loving horses, going through the pony club system and camp drafting and things like that. My dad's a vet. He's been in Clermont about 50 years. So I never really thought too much about what I wanted to be. Just when I got to grade 12, I'm like, yep, I'll be a vet, and put that down. I had a gap year for 12 months, went to England, worked in hunting stables, worked on a thoroughbred stud. And I think part of that is where my passion for breeding horses and stuff like that started, because it was really, really cool. And then I come back and completed my studies at the University of Queensland and graduated in 2004. Since then, I've worked sort of all around Queensland. My first job was up in Malanda at the Tableland Vets, and then down in a practice in Mackay, up at the Townsville Vet Surgery. Was there for a few years working under Brad Dowling, the specialist there. And then locuming around Longreach, Charleville, those sorts of places. Having a ball. And then 10 years ago, went back to Clermont, bought in with my father, grew the practice there. We have an equine specialist, Caroline Spelter, who I'm sure you all know of, and yeah, we grew that into a 7-vet practice, and then we sold to APM Animal Health in 7 years ago. So, 3 years ago. 3 years ago, we sold to APM Animal Health, and I still work at the Clermont Vets 2 days a week. As the lead veterinarian, I also work 2 days a week in recruitment. So part of my job is APM's a big centre, 60 vet practices, hundreds of vets through the company, and we have a lot of equine practices as well, like really quite well-known ones: Scenic Rim and Bow Desert, Samford Valley, Agnes Banks, around Sydney, and then Victoria Equine Group in Bendigo. So yeah, we're lucky to have a lot of horse practices. So just with my recruitment hat on, if you wanted to come and do some placement or look at new grad internship or job opportunities with APM, let me know. Otherwise, we would love to have you down to Clermont. Like I said, we have a horse specialist there, so we do a lot of horses. I ran the mare horse breeding season last season, and we bred 150 mares, which was a bit hectic, but very rewarding and very awesome. So that's sort of a little bit about me. So there's just a little thing there, that any internships or special placements I'd recommend to vet students. I do think, unless you're absolutely 100% sure you want to do just horses, I do think mixed practice is a really good place to start. You can really get your skills up in surgery land, doing dogs and cats. Cattle are fun to practice palpating because they're pretty tough. But yeah, getting in a mixed practice I think is really helpful. But if horses is what you want to do and you're sure that's all you want to do, then absolutely hook in. There's so many opportunities there for internships. Couple of courses I'd really recommend: going away and doing a breeding course. So I did mine through EVDS, and that was really helpful. And the big one is doing a good dental course. So I'm sure many of you will hear that a lot of us have done the dental course through Oliver Lyu at the Equine Vet and Dental Services at Grafton, and it is fantastic. a week all in, just horse's teeth, and then you get upskilled really quick and you can straight away start contributing to the practice you're in. And dentistry is lovely because, you know, there's a bit of pressure off, like it's not as if the horse is flailing around and dying. So it's a really good way to start off on your horse journey and just build that rapport with the clients. You know, once they know you can handle the horse and you can do a dental and stuff like that, they're more comfortable in emergency to call on you. So that's one thing I certainly recommend. Another thing I was going to mention is when I was a vet student, what helped me, I did placement at some equine clinics like Redlands and other ones around. I also helped out a little bit at Eagle Farm where Mark is here tonight talking. That's where he was starting. But the other thing I did was be a swabby at the racetracks. So I used to collect horse urine as a vet student, as a swab attendant with the Queensland Racing, and it was really helpful. I really enjoyed it, got camaraderie. It was a job handed over through the vet students. Again, I did that with Mark, who's here tonight. And it was a really good way to get a feel for the racetrack. That was something I hadn't had a lot of experience with growing up. Getting to, you know, interact with trainers, watch the racecourse vet in their natural habitat. So by following that racetrack vet around, you really got an idea for what's involved, and it certainly gave me a love of it. Like that Saturday nights, you know, I'd be doing the swabs at Albion, and it was just these crisp winter nights in Brisbane, and all you could hear was the whack, whack, whack of the trotters coming down the track. And it was such a fun thing to be part of, and horses are such a noble creature. So that gave me a little insight into that. And I do quite a few racetracks around. I think Britt, who's here tonight, he does some too all around. It's quite fun. Like, people find it daunting, and yes, a lot of trainers are knobs, but yeah, there's something fun about being a racetrack vet that I really enjoy. Like, I love watching the little faces on the horses as they load up to get in the barrier. It's just that excitement. Like, it's on, you know. And yeah, you can get some massive disasters, that's for sure. Like, I've had quite a few in my time. One race meeting a few years ago at Clermont, a horse took off on its way to the barrier, through the jockey, hit the side running rail, and the running rail come out and speared the horse through the chest, and the rail came out its side and its guts were on the track and it was bleeding out, and all the barrier attendants are yelling out, get the vet, we need the vet. And I looked at what was going on and I'm like, yeah, I think you need the good Lord Jesus Christ. But you know, they wanted me, and you're that person in the moment. So I listened to its heart and trying to give it drugs, but it was very shocky, so it was dying slowly. And it died before I managed to get anything into it anyway. But you know, it is there is some pretty horrific things that you can see on the racetrack, but don't let that put you off. Like, yeah, there's shit times with no matter what you do, but overall it is just such a rewarding experience. The EVA is great. You should be a member of the AVA, be a member of the EVA. You know, it's sort of the only group with voices that we can all be part of. I know the AVA and the EVA did heaps when New South Wales Racing was trying to have this really strict, you know, qualification system for vets to do vet work at race courses. So it mightn't feel like they do much at this stage, but I can tell you Dad's on the AVA board and they do so much advocacy for us, you know, standing up for vets in government regulations and stuff like that. It's just such an important thing to be part of. But also it's that camaraderie, like, you know, vets, this is your tribe. Like, it's just it's the best profession. And, you know, by getting to know more people, and everyone's been through something you're about to go through, so you can just call on that collective wisdom, and that's why the EVA is so powerful. It's educational, but it's also that sense of camaraderie. So I really encourage you to be members of that, and stay members of that. Most rewarding cases as a vet, gee, so many. You know, like I said, I've been doing it for 20 years. I absolutely love it, and it is hardcore. Like, it really can be. You know, you're dealing with these colics through the night. We hospitalise them all. You do get exhausted, and these horses thrash around and stuff. But you know, what we do is so meaningful. You know, we get a chance to really contribute, and it's just, it's just a purpose. It's a reason to get out of bed. Yeah, everyone else is sleeping, but here we are, and we've got these amazing skills, and we've got this ability to actually make a difference in that moment. And for that, it's such a meaningful thing that we get to do. So yeah, being a horse vet, if you're looking for it to make you happy, I don't think that's the case. I don't think vet science in general is going to make you this happy little Bambi kicking through the woods, but what I can promise you is if you hook in and get over the little humps that we all experience, it is just such a rewarding profession. It's fantastic, and it's an ability to serve. We're there for our clients, and we're there for our horses. It's not about us or our egos, or trying to be right or tell the clients that we know more because we're a doctor, but it's just that ability. These clients are trusting us, and it's such an honor to be able to serve them and help their horses, and it be such a privilege. So I guess that's how I manage my work-life balance, is I just see it as, so this is my profession, this is my lifestyle that I've chosen, and I love it. And yes, nobody likes getting out of bed in the middle of the night, but when I do, I just think, well, how lucky am I to have this gift that I can bring some comfort to a client, I can end some suffering or help a horse, and we are so lucky to be able to do that and get compensated for it. So yeah, so I do think, just it is hard, and being a horse vet is particularly hard, but I think sometimes the harder the journey, what are they, there's some meme on Facebook, the greater the storm, the greater the rainbow, or more beautiful the rainbow. And that's very true of being a horse vet. So yeah, it's full on, and you're gonna have hard days, but yeah, it is just fantastic. And horses are cool. Like, stitching up a horse's head that's like ripped its skin off is still probably my favorite thing to do. Like, they are cool creatures to work on. They do bring logistical trouble being so big. So I guess a couple of hot tips for you guys going into a veterinary profession where you treat horses. Number one hot tip is, if you've got the horse at your clinic or somewhere and you think it's possibly going to die, make sure it's in a stable that you can open up and drag that horse out, because it's not like a cat. You can't just pick it up and put it under your arm and throw it in the freezer. Logistics, people. Horses are big animals, so you want to be able to put them somewhere where you can safely get at them, where you can safely have an escape route, and you can get the bodies out. So we've got special stalls at Claremont Vets where we're like, oh yeah, if you that's where that one goes, because we don't think it's maybe going to make it, so we need to drag it out. That's my hot tip number one. Hot tip number two is sedated horses. I do feel a lot of us take sedated horses quite cheaply. I am notorious for over sedating. Now, that doesn't just apply to horses. I like all my animals stoned. It makes me much happier in life. But the problem with sedated horses is that they can look sedated, but they can react, wake up and lash out. So if you're doing something with a sedated horse, just make sure you're always talking to them, like pat them on the neck and just talk loudly to them so that they're aware that you're there, and then they're less likely to get a fright and actually hurt you. Problem with dentals and being overly sedated is they can sort of drop their head and look kind of scary, like they're going to trip over, which always freaks the client out. One way you can wake them up is punch them in the muzzle, but not always the best look. So the other way I do it is stick my finger right in their nostril like you're tubing them, and jam it in there just when the owner's not looking, and horses will always sort of react and wake up and take that weight off the front of them. That's another hot tip. Gosh, favourite stories, there's so many. The dramatic ones, the colics, the bad ones and the good ones. They're always dramatic but rewarding, because you're just doing all you can. I've done some really wild stuff over the years. Couple of, horses that need to be euthanized but are heavily pregnant, so we anaesthise them and just pull the foal out, trying to see if we can revive it, and haven't had a successful one yet. But the owner cares, and that's all we're there for, is to try and do our best, and we can only do the best in that moment. And sometimes you won't feel you can do enough, depending on the practice you go into, especially if you've seen fancy stuff happen in fancy specialist practices. You'll feel unequipped, but you know, what you have coming out of vet school is such a gift, and already you guys know so much more than what you probably think you do, and it's just having that confidence to hook in and have a go, and knowing that you can make a difference. And that's basically all I've got to say. So yeah, so I'm on Facebook to see a Salmond. You can contact me, tess.salmond@apm.com.au. My phone number is 04212 72185. I'd love to hear from anyone. Very sorry I can't be there to meet you all in person. Don't rate vertigo, not fun at all. But yeah, reach out if you want to come down to Clermont and play with us and do horses. That'd be awesome. If you want to look at some of our other equine clinics in APM, I'd love to hear from you. Yeah, just all have a great night, and yeah, enjoy uni. They certainly were the best years of my life. Thanks, guys.